plexus. Pampiniform plexus. What is the muscle here? Dartos. The detrusor is for the bladder.
Yeah.
This is dartos.
Dartos.
Name the two layers here. The outer layer here is the what? Tunica albuginea. The inner one is tunica vaginalis. What is this whole structure? Epididymis. This is the head, body or middle, and tail. What is this right here? Vas deferens. The vas deferens is exiting the pelvic canal, right? And this is it right here. This wraps around the back of the bladder, and this gland is the what? Seminal vesicle. The seminal vesicle and the vas deferens are opening into a little junction called the ejaculatory duct, which is opening up into the which area? Right here. This is the ejaculatory duct. This is the prostatic urethra. From the prostatic urethra comes the membranous urethra. From the membranous comes spongy urethra. So here, take a look at this. This is where the spongy urethra begins. So this is corpus cavernosum, and corpus spongiosum. Corpus spongiosum is the urethra, guys. Okay. So that's lining the urethra. The other two are corpus cavernosum. Okay. Now in the penis, this is the base, the shaft, and the glans. Now there's a flap of skin that covers the shaft. What is that called? Foreskin? Foreskin, which is called prepuce. Prepuce is the foreskin. Okay. So that is what this is.
Okay. And let's look inside.
Let's see. Did I miss anything?
There's a couple that I don't have marked up, but I don't know if I just missed it.
Urogenital diaphragm, we're not gonna do. Ampulla of vas deferens. So this is the ampulla of the vas deferens, where it thickens right when it goes along the seminal vesicle. This is what the ampulla is. So seminal vesicle, ampulla of vas deferens, ejaculatory duct, and that. Now we talked about the spongy urethra. We talked about the body. Now external urethral orifice. This orifice. Talked about the prepuce. Now I'm looking for a good model for the gubernaculum testes. So basically, the ligament that tethers the testes to the scrotal sac is the gubernaculum testes. Because sometimes when that twists, it causes a painful condition. Anybody knows what that's called? Testicular torsion.
Yeah, my middle son had.
Happens with contact sports. Yeah.
Testicle, and they were afraid it was going to twist because it was getting so big.
Yeah. So this thing that tethers, so ligament that tethers the testes to the scrotal sac, that is the gubernaculum testes.
Okay.
And then this right here is the suspensory ligament of the penis. Right here, suspensory ligament of the penis.
Okay.
Suspensory ligament of the penis. All right, so from the chart here.
I think so. I was trying to
Any questions? Okay, so here, what is the muscle here? Dartos. What is the muscle here? This one.
Oh, the muscle.
Muscle.
That's your
Cremaster.
cremaster.
What is this pink tube?
That's your vas
deferens. What is this blue and red stuff? Pampiniform plexus. So the spermatic cord consists of what three things?
The vas
deferens,
the
cremaster, and the plexus. Okay. Right? And the plexus is nothing but a continuation of the testicular artery.
Okay.
Now, what is this pink structure?
That's your seminiferous tubules.
Epididymis.
Oh, that's
The epididymis.
Okay.
And then this is the
Vas
vas deferens. Now, what is the outer layer here?
It's the external or
Tunica
albuginea.
albuginea. What is the inner layer here?
Tunica vagina.
Tunica vagina. Only these two are on your list. Tunica albuginea is the outer one, the more sort of fibrous one, and the inner, more delicate one is the tunica vaginalis.
Okay.
So here, in a longitudinal section, the outer white one is the tunica albuginea. The inner, more continuous one is the tunica vaginalis.
Okay. Perfect.
Now these are lobules,
Gotcha.
right? And what are these tubes here?
Those are your
Seminiferous tubules. Now this is for illustration. I'll show you a electron micrograph. In one testicle, they're big enough to fill 15 football fields.
That's amazing.
So these are the seminiferous tubules. Now from here, this area here is the Reed's testes. See here?
Okay.
Reed's testes. So they're produced here. They travel this way through the Reed's testes.
It looks like a kidney, doesn't it?
It does.
It does. So these are the efferent ductules. Efferent as they go out.
Efferent ductules. Okay.
And then they stay here in the epididymis.
Okay.
Head, middle or body, and tail. Where would you find older ones?
Tail.
In the tail. From here, they go through the
Vas deferens.
vas deferens. The vas deferens is exiting the pelvic
Okay.
bones,
Right.
and it's coming here. This is called the what?
That's your
Ampulla
Ampulla.
of vas deferens.
Ampulla.
What is this?
seminal.
Seminal vesicles. Now, what is this little area here?
That's your ejaculatory duct.
Ejaculatory duct, and it goes through, what is this
Prostate.
gland?
Prostatic.
Prostate and into the prostatic
urethra.
urethra. From the, so basically, this is your ejaculatory duct here. This is the prostatic urethra. From here to here is the one?
That's membranous.
Membranous urethra. From here to here is the
Spongy.
spongy
Little.
urethra. Yeah, what is this? The
I
yellow.
was gonna say
Starts with a C.
Bulb.
Bulbourethral or Cowper's.
Cowper's.
Cowper's
Okay.
gland. Now, what is this pink tissue here surrounding the urethra?
That's your
Corpus
spongiosum.
spongiosum. So, what is this erectile tissue here?
Corpus.
Cavernous.
Cavernous.
That's in the brain. The other brain.
Other brain.
So, these two are what? Corpus
Cavernosus.
cavernosum. This is corpus
Spongiosum.
spongiosum.
That's where the urethra goes through.
Right. Now, these two are the crusses. The crusses start here in the body, and they go on to form the corpus cavernosum. So these two are crusses.
Okay.
This is the prostate. Now, this is the shaft, the penis. This is the what?
Glans.
Glans. What is the skin flap here?
Foreskin.
Foreskin. What is the ligament that tethers the testes to the skin?
Gubernacular.
Gubernaculum testes.
Gubernacular. Okay. And then